Welcome to everybody. Today's presentation is Role of Nutrition in Optimal Growth and Immunity. A saying by Gabriel Mistral in 1948. Many of the things we need can wait. The child cannot. Right now is the time his bones are being formed, his blood is being made, and his senses are being developed. To him, we cannot answer tomorrow. His name is today. You see, growth and development in children. This is a graph how growth occurs. Growth has four interconnected phases: fetal, infant, childhood, and pubertal. It's episodic, static, and as a solitary periods. Development refers to unfolding of physical, cognitive, psychological, and socio-emotional skills. It leads to improved competence, autonomy, and independence of the child. So poor growth and faltering may occur in instance of repeated illness, nutritional insufficiencies, and feeding difficulties. Linear growth in children. Linear growth and physical maturation are dynamic processes comprising molecular, cellular, somatic, and organizational changes. Good nutrition is vital to ensure the availability of proper building blocks for growth. Developmental milestones, window of opportunities. You see, the greatest and most rapid period of development in human life occurs during early childhood. Period from conception till 6 years of age is crucial for the healthy cognitive, emotional, physical growth of a child. Growth of different body systems. You see, there is the pattern of growth curves. General curve, neural curve, genital curve, lymphoid curve. Bone mineralization in children. There is 40-fold increase in bone mineral content from birth throughout adulthood. By 18 years of age, about 90% peak bone mass is acquired. There are some factors affecting bone mass: modifiable factors and non-modifiable factors. Nutrition, calcium, vitamin D, sodium, protein, etc. are examples of modifiable factors. And non-modifiable factors are genetics, gender, and ethnicity. Brain development in children. The brain volumes achieved at the end of the first year is an important indicator of later intelligence. Cerebral volume is about 90 to 90% in 9 years of age, and it is about 72% by 1 year of age. Types of nutrients and their impact on growth. Nutrients affecting growth can be classified as type 1 and type 2 based on response to deficiency. More than one micronutrient deficiency can occur simultaneously, and a combination of these can cause impairment of growth. You see, in type 1 deficiency, child continues to grow, his tissue levels of nutrient fall, and specific symptoms arise. And type 2 deficiency, child grows slowly and tissue level of nutrient maintain, no specific symptoms. Energy needs are high during growth. Energy requirements per kg body weight per day are exceptionally higher during the first few years of life compared to adulthood. As for example, in first 1 to 2 years, it is 82 kilocalorie per kg per day, and during 17 to 18 years, it is 50 kilocalorie per kg per day. So, young children are more susceptible to energy deficiencies when compared to adults. Role of macronutrients in growth and development. Macronutrients such as carbohydrate, fat, and proteins provide energy for growth during childhood. components of energy required for growth are carbohydrate, fat and proteins. They are required for synthesis of new growing tissues, deposition of energy in new tissues. Energy demand for growth. Actually, 35% of the total energy during first 3 months of life is required for growth, whereas only 1 to 2% of energy is required in mid-adolescent for growth. Macronutrients in growth and development and their role. Carbohydrate. It is the major source of protein sparing necessary for normal fat metabolism. Protein is for anabolism of tissue proteins, helps maintain fluid balance, energy source, maintenance of acid-base balance, important part of enzyme and hormone. Fats. This is the concentrated energy source. It has protein sparing, insulator for temperature maintenance, supplies essential fatty acids, carries fat soluble vitamins A, D and K. Protein requirements for growth, striking a balance. Higher protein content of infant feed linked to higher weight at 2 years of age. Protein is the source of amino acid for synthesis of nitrogen containing components. Protein deficiency is linked to decreased linear growth. Dynamics of diet and protein intake and its effects on growth are complex. In this curve, there is lower Z score for body mass index in low protein group compared to the higher protein group. Role of micronutrients on growth and development. Micronutrients are vital for sustenance and optimal physiological functions. About 2 billion people globally are affected by micronutrient deficiencies. In baby, it causes low birth weight, higher mortality rate, impaired mental development, increased risk for chronic diseases. In childhood, it causes stunted, reduced mental capacity, frequent infections, inadequate catch-up growth, reduced productivity, higher mortality rate. And in adolescent, again cause stunted, reduced mental capacity, fatigue, increased susceptibility to infections. Impact of specific vitamins on growth and development. Vitamin A, its role is to preserve the integrity of epithelial cell, necessary for wound healing, growth and normal immune function. Vitamin C is essential for synthesis of collagen, iron absorption and transport. Vitamin D is necessary for formation of normal bones, promotes the absorption of calcium and phosphorus in the intestine. And vitamin E helps in neuromuscular function, tissue antioxidant and ecoenzyme. Impact of specific micronutrients on growth and development. Calcium builds and maintains the bones and teeth, essential in clotting of blood, influences transmission of ions across the cell membrane, required in nerve transmission. Potassium influences muscle activity. Zinc is a component of many enzyme system and insulin. Selenium is essential to tissue respiration, associated with fat metabolism, and vitamin E acts as an antioxidant. Iron is essential for formation of hemoglobin and oxygen transport, increases resistance to infection, functions as part of enzyme involved in tissue respiration. Iodine helps regulate thyroid hormone, important in regulation of cellular oxidation and growth. Now the practical steps for optimizing bone growth in children. Non-dairy source of calcium and vitamin D, soda consumption and type and amount of exercise at routine visits. Encourage increased intake of calcium and vitamin D rich food. encourage weight-bearing activities. Routine screening for vitamin D deficiencies is not recommended in healthy children. Consider a DXA scan, that is dual energy X-ray absorptiometry, in children with medical condition associated with reduced bone mass, increased bone fragility, and clinically significant fracture sustained after minimal trauma. Role of nutrition on brain development. Nutrients like amino acids, precursors of neurotransmitters. Essential fatty acid is necessary for structural component of tissues, cell membrane synthesis, neurodevelopment, and sensory maturation. Omega-3 fatty acid is a component of brain phospholipid membrane. Maturation of cortical functioning in early life and for brain development. Hindrances to good nutrition in children. Feeding difficulties. Categorization of children based on their eating behaviors and caregiver feeding style. Feeding difficulties can be due to child limited appetite, selective intake, and fear of feeding. As for example, misperceived energetic, apathetic, organic diseases, etc. can cause limited appetite. And again, misperceived, neophobic, and mildly selective and highly selective children have selective intake. Fear of feeding can cause also feeding difficulties. Caregiver feeding styles. He or she may be responsive, controlling, indulgent, and neglectful. So, therapy should be tailored to address the child behavior and feeding practices. Hindrances to good nutrition intake in children. Picky eating and food neophobia. Picky eating, a consistent unwillingness to try new food or having strong food preference or choice of food groups. It can cause limited exposure to dietary varieties and are linked to deficiencies. Picky eating behavior in children may have adverse effects on growth. Neophobia is a tendency to reject unknown or novel food, may result in dietary patterns, less preferences for intake of fruits and vegetables. Neophobia is not a permanent condition, and repeated exposures can improve the acceptance of new food. Hindrances to good nutrition intake in children. Family variables. Frequency of shared family meal is linked to nutritional health of children and adolescents. This meta-analysis finding showed that sharing 3 or more family meal time per week was associated with decreased risk of overweight, eating unhealthy food, disorders eating, and increased odds for eating healthy food. Now, some practical feeding tips for children of all age groups. Avoid distraction during mealtime, such as television, cell phone, etc. Maintain a calm and pleasant attitude throughout the meal. Feed the children to encourage appetite by limiting meal duration. That is 20 to 30 minutes is enough. Providing 4 to 6 meals or snacks a day with only water in between. Systematically introduce new foods. Serve age-appropriate foods and encourage self-feeding. Accept age-appropriate mass. Make family meal time a priority. Nutritional status, immunity and infections. Children are particularly vulnerable to malnutrition and infectious diseases, many of which can be effectively prevented or treated. About current understanding of immune status and infections. Developmental milestones for immune development. This graph shows few aspects of adaptive and innate immune systems are not fully functional at birth. Low exposure to antigen up to birth makes children more susceptible to infection. Vicious cycle of undernutrition and infection. Emerging concepts. Malnutrition causes poor growth and repair. Again, it causes decreased immunity, and decreased immunity causes microbiome inflammation, subclinical infection, overt infection, and again it leads to decreased nutrients, and it again cause malnutrition. So subclinical infection, intestinal inflammation, altered gut microbiota also play a vital role in the vicious cycle of infection and malnutrition. Impact of infection on growth in children. Infection has a negative effect on the growth of infant and children. Repeated diarrheal illnesses have shown to have an adverse impact on children growth. Poor sanitation, recurrent infection and growth. Stunted growth has been known to occur even among well-fed children with poor sanitation and hygiene, which may cause stunting by precipitating environmental enteropathy, that is leaky gut. Environmental enteropathy shifts the energy needed for growth toward fighting against subclinical infection. Role of sanitation, hygiene in growth. Linear growth in early childhood is influenced by household water, sanitation and hygiene practice. Household access to toilet facility was found to be associated with 16 to 39% reduced odds of stunting among children ages 0 to 23 months when compared with open defecation. Open defecation and its association with stunting has been studied in some countries with conflicting results. Actually, globally, 40% of population lack access to safe sanitation, and 15% of population still defecate in the open. Nutrition sensitive programs should be emphasized in developing countries rather than only nutrition specific ones to address the childhood starting. Impact of antibiotic use on growth. There is controversies surround the effect of antibiotic use on the height and weight gains among children. Antibiotic use may not be the most practical option for the management of malnutrition except in vulnerable population. Role of specific nutrients in the development of immune system. Let food be thy medicine and medicine be thy food. Hippocrates. Effect of malnutrition and immune parameters. Adverse consequences of malnourishment in children with infections could be attributable to impaired immune function. Malnutrition can cause impaired gut barrier function, reduced exocrine secretion of protective substances, low level of plasma complements, atrophy of thymus, reduced delayed type hypersensitivity responses, normal or increased level of IgM and IgG, reduced level of antibodies produced after vaccination in severely malnourished children. Different type of malnutrition are associated with different set of immunological alteration, and underlying mechanisms are poorly understood. Role of proteins in immunity. Protein energy malnutrition affects all aspects of immune system. That is, impaired cell-mediated immunity affects phagocytic function, impairs complement systems, affects cytokine production, reduces the concentration of secretory immunoglobulin A antibody. Protein is crucial for immunity and its deficiency increases susceptibility to infection. Vitamin C and immune system regulation. Vitamin C deficiency causes decreased stimulation of leukocyte function, affects redox reaction and inflammatory response, affects the synthesis of collagen and phagocytic function, reduced delayed hypersensitivity reactions. So vitamin C serves as a regulator of immune system, and vitamin C deficiency may affect resistance to infection. Role of zinc in immunity. Zinc is a key nutrient required for optimal functionings of innate and adequate immunity. Prolonged zinc deficiency leads to reprogramming of the immune system, leading to activation of HPA, that is hypothalamic pituitary adrenal axis, and chronic production of glucocorticoids. In this picture, zinc deficiency impaired this picture shows zinc deficiency impaired phagocytic activity and natural killer cell, generation of oxidative burst and complement activity, involution of thymus, reduced proliferation of lymphocytes membrane of Th2 cells, depressed antibody response to T cells dependent antigen. So there is complementary roles of vitamin C and zinc in immunity. Vitamin C and zinc have complementary roles in supporting innate and adaptive immunity. Role of vitamin A in immunity. Vitamin A is important for regulation of innate and adaptive immunity and potentiates humoral antibody response. Routine vitamin A supplementation may provide time-sensitive survival benefits very early in neonatal period. Vitamin A deficiency affects gut mucosal integrity, affects balance of Th2, Th1 T cell response, interferes with phagocytic and natural killer cell functions. Vitamin E and selenium on immune function. During infection, vitamin E and selenium act synergistically, but via independent mechanism to reduce tissue damage. Vitamin E deficiency impairs both humoral and cellular immunity, affects T and B cell functioning, affects lymphocyte maturation. Selenium deficiency negatively affects immune cells during activation, differentiation and proliferation, affects phagocytosis, increase virulence of certain viruses. Iron in ironing out immune functions. Iron is an important element necessary for normal immune system development. Availability of iron influences bacterial virulence and host antimicrobial defenses. Iron deficiency impaired bacterial proliferation, impaired neutrophil and natural killer cell mediated killing, affect T cell proliferative responses, shift the immune response towards the Th2 type. Iron supplementation can be considered applicable in otherwise healthy children and should be targeted to those who are anemic and at risk of iron deficiency. Role of nucleotides in immunity. Potential mechanism of action of diet and nucleotides on immunity. Effects of nucleotides. Aids in lymphocyte maturation, activation and proliferation. Enhances phagocytosis, affects delayed hypersensitivity response and allograft and tumor response. Positive affects immune response during infection. Deficiency of nucleotides has been linked to significant decrease in the host immune responses, feeding route and immunity. Absence of enteral nutrition may alter the gut microbiota and affects gut innate and acquired immunity. Lack of enteral nutrition hamper innate immunity and acquired immunity. Enteral nutrition serves as a practical way to preserve gut immunity, and so it is imperative to shorten the duration of absence of enteral nutrition. Importance of gut microbiota in immunity. Functions of gut microbiota. Human gut microbiota more than 10 to the power 13 bacteria. This is the most densely populated ecosystem. immune hemostasis, extensive crosstalk exists between the gut microbiota and host immune system. Dynamic changes in gut microbiota occur during the first 2 to 3 years of life. Dysbiosis or alteration of gut microbiota is related to the development of immune-mediated disorders. Gut microbiota changes and immune-mediated disorders in childhood. Immune-related diseases in children have been linked to changes in the gut microbiota and dysregulation of immune function. Suggested role of gut microbiota. There is role of gut microbiota in asthma, eczema, food allergy, especially cow milk allergy, necrotizing enterocolitis, inflammatory bowel disease, and irritable bowel syndrome. Manipulation of gut microbiota. Manipulation of the gut microbiome through the diet and or probiotic or prebiotic supplementation in selected population may serve as an alternative approach to improve host health status. Role of probiotics in childhood diseases. A great deal of research is ongoing with respect to probiotics use in prevention and treatment of diarrhea due to infections, antibiotic associated infections, irritable bowel syndrome, necrotizing enterocolitis in very low birth weight infant. People subgroups at risk of side effects of probiotics include critically ill patients, those who have surgery, very sick infants, people with weakened immune system. It is important to note that not all probiotics have the same effects. Benefits of probiotics are strain specific. Probiotics differ in composition and biological dose. Key messages. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. Thomas Edison. Normal growth can vary significantly between individual children. Nutrition in utero and early childhood can have a profound effect on the child health. Adequate level of micronutrients and macronutrients are essential for optimal growth and development of children. Protein, energy, calcium, vitamin A, iron, and zinc are important nutrients required for optimal physical growth and development in children. Infection and nutrition are intricately linked. Development of immune system is a continuous process through embryogenesis and childhood. Nutrients such as proteins, nucleotides, vitamin A, C, and E, zinc, and selenium play a crucial role in development of immune system. The gut microbiota is one of the most densely populated ecosystem that is highly adapted and personalized. Dysbiosis or alteration of gut microbiota is linked to development of immune-mediated disorders. Manipulation of gut microbiome through probiotic or prebiotic supplementation may serve as an alternative approach to improve host health status. Thank you.